Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And today we have with us another special guest, and he goes by the name of Jasper Freeman. Now, this is an episode you absolutely have to listen to if you're in the medical sales space, because Jasper is the master at insurance. He's the National Accounts Director for SC Pharmaceuticals, and he's been in both the biotech and pharmaceutical space, and all he's been doing his entire career is insurance. So if you want to know where the future of medicine is headed, if you want to know how to truly be in the right position within your career, and if you're thinking about getting into this space and you don't know about the insurance game, this is the episode you absolutely have to listen to. The current administration, the current politics, the current economy, it's incredibly relevant. This is a must-listen episode. Again, Jasper Freeman with SC Pharmaceuticals. As always, we do our best to bring you innovative guests that are doing things differently in the medical sales space, and I really do hope you enjoy this interview. All right, Jasper, how are we doing today?
I'm doing well. Thank you, Samuel. Finally get a chance to meet you.
Yeah, man.
Your sister talks very highly of you, by the way.
Hey, man, I appreciate you. I appreciate her, and I appreciate you sharing that with me. SC Pharmaceuticals, tell us a little bit about the company, what you guys are working on, and your place in it.
Sure. SC Pharmaceuticals stands for subcutaneous. The first product that we came out with is a product for cardiovascular disease, for heart failure. And up to this point, if patients who are on diuretics, if they started to fail their diuretics from, maybe going to a wedding or going to a birthday party, eating things that they normally don't eat, maybe with a lot of salt in it, their diuretic would start to fail. And so they start gaining fluid, they build up fluid in their ankles, and mostly in the interstitial areas, which sometimes you can't even see.
Sure.
And the only recourse for doctors and for patients was to go into the hospital. And, there's who wants to go to the hospital, right?
Right.
Usually it's like 3 or 4 days. Somebody's waking you up every hour on the hour. And so my company came up with the idea of, why don't we put this into a device that actually can deliver the diuretic, furosemide, over a 5-hour period of time from the comfort of a patient's home. Wow. And do it for a fraction of the cost of a patient going into the hospital. Okay. Insurance companies should like it, patients should like it, doctors should like it. And so that's been the battle. My current role right now is I retired 5 years ago, and did a little traveling, and essentially got bored. So I started consulting, doing payer insurance company playbooks for smaller companies who couldn't afford to have a team. And one of my clients, SC Pharma, asked me to come in and be an account director, national account director for them. So I right now cover all payers across the board. As far as PBMs, right now I have CVS, I have Optum, and I have Prime. I also have 52 state Medicaids too at the same time. So it keeps me relatively busy. But the company's doing well right now. So
that's the beauty of medical sales, right? Where you can have an amazing career, you can retire, and because of your skill set, be called right back in and literally have your second act and enjoy it like you're enjoying it now. So
it's pretty sweet, versus say a professional athlete, right? I mean, once they're done, they're done.
Right.
All the knowledge that I've obtained over the last 35, 40 years is really of value out in the marketplace right now. And so I was a leader of people of the job that I'm doing now. Now I'm doing that baseline job and actually doing it at a high level because I have been a leader before. So I'm helping my boss to be more effective.
Absolutely. So let's talk about it, because people listening now, a lot of them, they want to enter medical sales. They've never even, they have no context for the things you're talking about. And then of course, a lot of them are in medical sales, but they might not be familiar with your space. So let's go back to SC Pharma and the device. Give us a little bit more on what exactly is the device. You said it's at home. How are you actually using it? And is this in the pharmaceutical space? Is this more in the biotech space? And this more in the medical device space? Give us a little context for our audience.
Sure, sure. Right now, FUROSCIX, and that's the name of the product, is actually paid for and adjudicated on the pharmacy side. So it is a product right now that, you've got to go through a specialty pharmacy hub of which a doctor writes a prescription through our system. That hub gets a prescription, they do the adjudication, looks at insurance for the patient, gets everything done, issues a copay to the patient, and the product is sent out to the patient with instructions on how to use it. It is a device that actually attaches to the abdomen. It's about the size of a cell phone,
Okay.
and attaches to the abdomen with 3M tape on it. And the patient, after making sure the air is clear and there's no lotions or anything, they push a button, and actually a small needle comes out. And I've heard that it's pretty painless,
Okay.
and it actually starts to deliver product over
Okay.
the 5 hour period of time, that diuretic over a 5 hour period of time.
Wow. Okay, that sounds pretty innovative. Okay, so with your role in the insurance space, give us a little context in how that plays into a product like this and getting to the public and getting to someone that can be at home using it right now. Again,
Sure.
our audience is
Yeah.
not familiar with how insurance plays into everything, and that landscape is always changing. So please share with us how it plays into this product.
Sure. And I would say insurance is more important in the United States than it probably is anywhere else in the world.
Sure.
Most other civilized countries, the government actually negotiates with pharma, drugs, medical equipment, and so forth, and get a discount as a result of all of their patients. We in America, we don't do that.
Okay.
Essentially, our job pays for our commercial insurance. Once you get past 65, Medicare pops in there. And for those that are in the Medicaid space, they also, have to be taken care of also at the same time. So insurance is really important. So I'm talking about the big three. They pretty much cover everything. CVS Caremark,
Okay.
United Healthcare Optum,
Okay.
and Express Scripts. Those are the major three ones. And then all of the other smaller health plans like Blue Cross Blue Shield of California, Blue Cross Blue Shield of Illinois, they're all underneath those PBMs.
Okay.
And PBMs stand for Pharmacy Benefit Management Company. So they manage the benefits. A while back, maybe a little bit before I started, usually you write a prescription and there was nobody controlling for the insurance. So your job had insurance for you, but if you were written a prescription, if a prescription was written for you, there was nobody managing and overseeing, well, is that the right cost? Are we being overcharged for that? Is the
Sure.
patient being overcharged? So these people came out, PBMs came out as a result of trying to manage that pharmacy benefit portion. To the point now they make billions of dollars, billions and billions of dollars. And now there's a big drive right now to try to get some clarity around that, because now the employers and people who have employed them are saying, wait a minute, you're taking an X amount of dollars, but you're only giving me, this kind of discount back. Where's
Right.
the extra money going? Right. And
Right.
so now there's been a push now to get more clarity, to the point where one of the PBMs has moved to Switzerland, and another one moved to Ireland
Wow. Like they're
to
leaving.
avoid the
To get out
U.S.
of Dodge to
oversight.
avoid.
Yes, sir.
Okay, so wait. So let's go back a little bit, because I think what I want to really dig into today is just how did we get here, right? And with
Yeah,
our current administration, with what's going on with Medicare, Medicaid, and Dr. Oz taking over, how did we get here? Why did this happen? So you just talked about how it used to be that uh, insurance companies had free reign and they can make the decisions and they can charge whatever they want, and it was kind of like the wild wild west. And then these pharmacy benefit managers kind of came in to regulate things. Let's talk about that just for a second. How long ago was it like the Wild Wild West? And give us a little bit more insight on what the landscape looked like.
Sure, I would say in the 60s,
Okay.
probably around that area there. Essentially, what was happening was the budget for people kept going up higher and higher. So let's just say if you work for, you know, um, any one of the industry, Heinz ketchup company,
Sure.
you gotta, your insurance was taken care of. You work for them. You got a card. You go to see your doctor. That was pretty much, paid for. And then the doctor would write you a prescription, so you went and filled it at your local Walgreens
Sure.
and it was adjudicated and everything was good. However, as drugs became more and more expensive, right, and they started to have more effectiveness and the cost of drugs started to go up, companies kept looking at their budget and their bill every year and they go, wait a minute, this is up 20% from the previous year. We need somebody to manage this. And that's how the PBMs were able to kind of get their way in. They were supposed to be a way of just managing that pharmacy benefit. But it's become so big now because drugs like Humira or some of these drugs that are multi-billion-dollar drugs now there's so much money involved with them that if the company gave you say a 20% discount, that could be $60 billion off of a drug that is that high cost.
So
So it's become big now.
okay, so the 60s is when the PBM started to show up. When did it get out of control and when did the PBM start to just become their own players that made all this money, and
Yeah, I would say in the 70s and 80s, about when I started, the PBM started to become very, very big. And as the cost of drugs went up, of course, they made more money as a result
sure,
of it. And a lot of these
sure.
companies, CVS Caremark, one of the largest, retail pharmacy distribution networks in the country, um, you know, they're pretty much run their
Oh
stock. They
yeah.
have
Oh
stock. They
yeah.
have a board of
Yeah.
directors.
Yeah.
So they got to answer to these folks also. So they carve a little bit more out of the amount of money that they were taking in for employers.
Was there a time when it was great to have the PBMs and the intention of them regulating things was well received and they were doing that? I mean, did that ever exist? And if it did, how long did that last?
I'd say it's probably by the 90s, I would say that it started getting out of control. So let me give you an idea of why.
Sure.
In pharmaceuticals, say you have a drug for diabetes. Um, the first drug that comes out is usually that original drug that helps the type 2 diabetic to live a normal life. However, another company comes out and tweaks the molecule a little bit, and now it's a little bit better. Maybe you don't have to take it 3 times a day. Maybe you
Sure.
have to take it twice a day. But that company still wants to get their product on formulary with that PBM. So now they say, well, we'll give you X amount of percent off of our drug to get ourselves there. And so that keeps going, right? The next generation, the third generation, the fourth generation, they're all wanting to give a portion of their profits to the PBM to gain formulary approval. So when the doctor writes the prescription, it actually gets filled and doesn't get blocked. So that's how they got more and more power because the cost of drugs and biologics. Biologics are drugs that actually use human tissue or
Sure.
cells to actually make other drugs. So, but those are very expensive. They're very expensive. So, the percent of profit you make off of a biologic is a lot more than a pill that someone's got to take for the rest of their lives.
Gotcha. Okay. So the 90s, it starts getting out of control. But gosh, it is 2025. So that's 35 years or 30 years of out of control. And you're saying now they're starting to reel it in. What's been happening the last 30 years and why is it so definitive that now they're starting to reel it in?
I would say probably because of the lack of transparency. I think the federal government now has become a bigger um, portion of the healthcare dollar. So Medicare, Medicaid, military, VA, it's easy 50% of the total US dollar.
Okay.
So you've got the federal government involved now also because they want the lowest prices that they possibly can get
Right.
because it's less for you and I as taxpayers.
Right.
The employers also want the exact same thing, that they're saying, hey, the cost of this is why copays have occurred. So you can't go to a pharmacy or to a doctor anymore without having something come out of your pocket.
Right.
And that's their effort to try to do cost sharing, right? Well, they know the price of everything is going up. So if the patient is actually sharing in that price, maybe we'll be a little bit more judicious in the way that we utilize the healthcare system.
Got it. Okay. So I guess, is it the federal government that's then now saying, "Hey, this is out of control. We need even more transparency, and we need to make the pendulum start swinging the other way."
Yes, and you've seen it in different types of laws and acts. Right now, it's the IRA, where there's part of the IRA is that there's got to be clarity about what happens with rebates,
Okay.
so that there's no smoke and mirrors about where the profit is. But that also caused the move to Switzerland for a certain portion commercial and the move to Ireland where they can, I don't want to say manipulate, but I want to just say that be more protected and lower their risks for exposure as far as the rebates concerned because they got board of directors, they got
Yeah.
stockholders,
Yeah.
they
Yeah.
got people who are really looking at this. So I would say that this is just where we've come to right now. I think they're just too powerful. They're controlling billions of dollars
Yeah. Yeah.
of product right now, and I just don't know if it can be stopped.
So when a big player like this, a PBM, exists in the United States and then decides to move to Ireland to avoid things, talk to us about what's changed for them, right? And in a little bit more detailed level, what were they at risk for in the United States that they're no
Mhm.
longer at risk for because they moved to Ireland?
I would just say clarity and transparency around the level and the number of dollars that they take in
Okay.
rebates from and biological and medical device manufacturers.
Got it. Got it.
And now that you've taken that, to another country that has a whole different tax structure versus the United States, that might be beneficial for you and
Wow.
for your stockholders.
Wow. So how does this affect every level? So let's talk about it. You have these companies now, the federal government saying, "Hey, we need more transparency. You guys are taking too much money." And let's pretend that there's success there. That because the federal government's doing this, the PBMs are now forced to adjust things and make it, I guess, less expensive. How are pharmaceutical companies and medical device companies affected? How are doctors affected? And then finally, how are consumers affected?
Yeah. So let's start with the insurance companies. They're manufacturers.
Sure.
They're affected because now the PBMs and the insurers are much more risk averse, meaning that they're not going to add that fourth product or that biologic, or they're not going to add something to their formulary because they don't know what their profit level is going to be off of
Sure.
adding that in. So it's difficult. It's more difficult. My job is more difficult today than it was 20 years ago or 10
Sure.
years ago.
Sure.
For patients, patients are going to find that don't have as much choice. So their doctor may write a certain product for them for, say their heart disease, and maybe that product is not available through the insurance that their employer or through Medicare are able to provide to them. So the patient may not be able to get the drug they want. They'd probably be given an alternate drug that may or may not have the same efficacy or safety profile or whatever. For physicians, they're pretty much fed up with the insurance situation.
Mhm.
They're saying you're trying to dictate to me how to best treat my patients, and you don't know my patient. Jasper's different than Samuel, and I need to treat Jasper in this way. I need to treat Samuel in this way. And
Sure.
here's the tools that I need to be able to treat them effectively. And they're just frustrated with that whole process there.
Got it. So, okay, so let me get, From my perspective, you're telling me that on one side, PBMs were making too much money, but even though they were making all this money, they were allowing more drugs available to more patients, and manufacturers were happy because they can get more drugs on formulary. Patients were happy because they can get access to drugs that they need. It sounds like everybody's winning, and of course the PBMs are winning because they're making all this money. The government, though, I guess, is the one that's suffering from that vantage point.
Yeah.
And now the government is trying to push things the other way, which makes the patients have less access to the drugs they need. Doctors have less choice of the patients of what they want to give the patients, and PBMs make less money. So everyone's suffering except for the government.
Yeah. But that's 50% of the total healthcare dollar. And the government's always going to strive to get the best price. And they're the bully on the corner. So,
Yeah.
versus say you working for Heinz or Honeywell or any of the other
Sure.
big corporations, they don't have the same muscle power that the United States government
Government.
does. So the PBMs are listening, the insurers are listening, everybody's listening to what the federal government has to say now.
Okay, so now I'm going to put it on you,
Okay.
Jasper. What's the solution?
What's the solution?
Jasper, how do we solve
Oh my
the world's
God.
problems on this
Woo.
podcast today?
Oh man, I don't think I'm ready for that question. Uh, I would say that it starts probably an area that we haven't even talked about, and that's in the training of healthcare personnel, doctors, nurses. All of the doctors that you and I see, they pay for their own medical training. That is just in America. In other civilized countries, they support the medical training of their physicians, and therefore their cost of healthcare is a lot less as a result of that. Here in the United States, if a doctor gets to residency, like your sister, and maybe goes into a specialty, they could have four, five, six, $700,000 in loans for their degree. So now they need to make enough to be able to pay those loans back. And that's the difference in the healthcare costs between other countries like Japan or any of the other civilized countries and the United States right now. Um, I think that's just a place that we could start, and it starts to lower the overall fees. And if the federal government is helping to train you, then you have a certain responsibility back to the government as a result of that.
Let's dig into that a little bit. I
Yeah.
want to understand that on a granular level. So you're saying something that can contribute to the solution is to better train physicians to lower the cost of the physician?
No, so that when a physician actually goes through training, the cost of that is taken care of to a certain extent by the government, which
Okay.
is what happens in other civilized countries. So
Okay.
as you can see, I need to make, if I've got a bill of, $20 to $60,000, depending on my specialty per month, that I've got to pay back the loan that
Right.
to help me to get to this point, that I need to make a certain amount. So I need to be, to charge a certain amount for my services, that if I didn't have that debt when I first came out, then I wouldn't have to charge that much. Now I can just start doing my job in an effective manner without worrying about, do I have this big loan that I have as a responsibility for?
Okay, so let's trickle it down. So let's pretend that tomorrow the government says, you know what, we're cutting med school fees in half. And now you doctors do not have to feel compromised about the choices you make. How does this still solve the issue of when the PBMs are making money, everybody's winning except the government? And when the government's happy, everybody's losing, including the PBMs.
Yeah, so I thought that that was the first step, is just to lower the cost for doctors and so forth. The other assistance is going to be more of the government involved with the treatment and distribution of drugs and treatment to patients. So right now we're at 50%. We probably need to be at 75 or 80% to start to solve that problem.
I
And
see.
then the big bully on the corner can then dictate to the PBMs, no, you can't move to Switzerland, you can't move to Ireland. No, we need to see your books to know exactly what we're paying for and that we're getting the lowest cost for our constituents.
So when what I love about your insight, Jasper, is you have a global insight, right? You understand how it works in the United States, and as you put it, you understand how it works in all these other civilized countries. Give us a country that's doing it, in your opinion. I'm not even gonna say the right way because I think that's not fair, but better than we are. Give us a country that's doing it a lot better than we are, in
Yeah,
your
you'd
opinion.
have to go just do some reading on Japan and their healthcare system. You will probably be surprised at how well they do it. You can look at Canada, you can look at Australia, you can look at Britain, any of the European countries. They understand that this is not like benefit. It's not something that's just entitled to a person. This is actually something that is a right to have good health care. Uh,
What's the biggest impact on the population when they're doing it like the way Japan's doing it, as opposed to the way the United States is doing it?
the biggest impact is, I would say, the total quality of healthcare is higher in those other countries, meaning that we're not number one. The way that we're doing it, we're not number one in fetal mortality. We're not number one in treating cancer. We're not number one in treating multiple chronic diseases. We are number one in research and development and of new, very innovative biologics and drugs that help us. But we're not number one in the way that we're treating the inpatient. And they seem to get better healthcare outcomes in those countries as a result of the way that they've got it laid out.
So then, and excuse the ignorance, because I'm going to say something that someone of your knowledge, you might be like, what is he talking about? So, when you hear about an American tourist, right, and they have an accident in Japan, and they're quickly flown to the United States to get the best care. And on the same token, you're saying that actually for a lot of these same issues, Japan has the best care and they have better patient outcomes than the US. So in that simple example, why are they flying that person all the way to the US? Why aren't they taking care of it in Japan, especially if it happens in Japan?
Yeah, it might be about insurance, depending
Simple as
on
that.
what the insurance covers, right? If you cannot, be treated there now, if it's life-threatening, they've got to be treated in Japan. It's not going to, I mean, it's your life. You don't care how much it costs at that particular point.
Sure.
But if you need a major surgery, appendicitis or a blocked coronary artery, something serious like that, you might want to fly back, but also you're jeopardizing your life by making that trip back to the United States
Sure.
when you could be treated effectively there. But the only thing I can think of is maybe it's insurance. I can't think of any other reason why
Wow.
that person would want to fly back. And that's a long flight.
Right.
Trust me, I just did it in
17
December.
hours.
So I just did it in December. So it's a
Wow.
long flight. Yeah.
Yeah. Wow. Okay. So we're in the state we're in now. What direction are we going right now?
Oh, that's that's tough because I think the current sentiment right now is to be more isolationist and to be more capitalist and to do it the American way, which is the way that we've done it up to this point. So I don't see it changing at all. I think it's going to, um, I just don't see it changing from where it is now. We just don't have the innovative people in positions of power to be able to make the positive changes that we need. And granted, we're still doing pretty darn well. We're not number one. You would think if our system is so good, then we should be number
Number
one in
one, and
all
we're
those
not.
things that I
Simple as
mentioned
that.
before,
Yeah,
right?
yeah.
Yeah.
So then, if PBMs are leaving to other countries to avoid having to be transparent, patients are compromised because they can't get access to the drugs they need. Doctors are compromised because they can't write what they want for their patients. what will this look like? And of course, you don't know, right? We're just talking here. What will this look like 15, 20 years from now? I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of.
So here's what's happened. The one good thing, there's many great things about capitalism, but the one good thing is that there's a gap, somebody's going to figure out how to fill it in. And what has happened is multiple smaller PBMs have popped up who say, here are our books, here's what we charge, here's what our the costs and the operations of our organization, and to give you the type of response that you need. And so multiples of these to come up. So I think those companies are going to start to get more and more power. They're going to get more and more customers and clients. And I think over time they're going to chip away at some of the big PBM players right now.
Got it. And then this is going to, by them doing that, patients are going to have more access to more options. Doctors are going to be able to write more freely.
Absolutely.
Got it. Got it. Let's switch gears a little bit and take it now to the medical sales professional. Gosh, back in my day, they talked a lot about, in my early days, they talked a lot about how if you want to be a competent medical professional in the United States, you better learn the insurance game, and you better know that insurance game like the back of your hand. Talk to us a little bit about that. Is that true today? And when I hear insurance, I just think it's changing so much. I almost feel like, how do you get on top of that game? But anyway, please give us your thoughts on that statement.
You better know insurance inside and out. And that's been my job with everybody that I talk to, all the sales reps that I support, all the regional sales directors, the marketing people inside. You just got to know. And it's like that one blips they sent us that says, if you want your bonus, click on this dot, but the dot would move every time you go to click on it.
Right.
That's how insurance, because it's constantly changing. It's
Right.
you're never going to be an expert in it. You may have fundamentals that allow you to understand how it works, but there's going to be multiple details that will pop up that will have to be taken a look at. For example, Medicare is changing a lot. Next year or this year, patients have a cap of $2,000 on their Medicare. So the gap has actually been defined now. So it used to be if you're on a biologic, hundreds of thousands of dollars a year, you'd have to find a way of paying a portion of that. But now it's being capped, and that's putting more pressures on the PBMs, right? Because they're saying, well, shoot, that means I'm going to have to absorb a lot more risk.
Losing a lot.
Yeah. So they're saying, hey, we've got to do something about that. And what that has resulted in me as a medical professional is it's more difficult for me to help my company get my drug or my device on formulary, because they're saying, no, we're taking drugs off the formulary. We're not putting drugs on the formulary. I don't care how good it is.
Yeah. So then, and what's your recourse? I mean, what do you do?
You stay at it every day, become relentless. I'm the best email writer because I write people emails. I tell them the whole story, but do it in a very succinct and very clear, like this is what it's going to do for you. This is how it's going to help your organization and help your company and help you and your career. So you become good in communicating with people. And I just want to get a clinical so that I can share the data on my product, FUROSCIX, with the key internal people who are managing the formularies.
Sure. Okay. So let's take it back then to our audience here. Uh, like I said before, a number of people want to get into medical sales. A number of people want to work and sell a product like this. Where
Right.
it's a little bit, it's biotech, right? A little bit of device, a little bit of pharma,
Mhm.
and the people that are just new to this space and maybe 3, 4, 5 years in, and they're saying, you know what, I'm listening to this episode and I'm thinking, wow, I need to increase my insurance game. What do you advise they do?
Everything about insurance, especially from a government standpoint, is online. Go to cms.org, and every document from Medicaid to Medicare to VA to any of those things are addressed there. You can look on CVS.com also if you want to look into the CVS and how their PBM works. You can go online and go to Google or any of your search engines and be able to look up how is commercial, how is it changing, what are the challenges that people are dealing with now. And I'm sure this is, and if you're in the industry now, I'm sure that you're involved with discussions. If you're at a national meeting, sales meeting, which I'm going to next week, this is discussed. Insurance is going to be discussed about the challenges because sales can't increase at the level that senior management expects unless there's open road there, right? The sales rep you can go all day long and convince, Dr. Samuel that, FUROSCIX is the best product, but if every time he writes it gets blocked or the
Yeah,
cost of it is
I know what you're talking
so
about.
prohibitive that the patient says, no, no way, I'm not going to do this. So I'm sure they're dealing with it already. And the things that you can do is help doctors to understand the system, how your product is being reimbursed by the, one, two, or three insurance companies or PBMs that in your territory, and pretty much try to understand and learn as much as you possibly can. Stay close, and I talk to my sales reps almost every day
Oh, wow.
because they run into a problem. I try to explain to them,
Sure.
what the issue is. I utilize my scientific people to help me build a case and to build the right communication on what the issue is, and then we just keep working to overcome it. You have to be relentless.
So then, do you recommend that a sales rep that wants to be in management, wants to be a director someday, wants to just keep advancing their career, do you recommend they actually have a stint in key accounts where they look for an opportunity within the company they work for on the insurance side? Or do you think that's unnecessary and they just need to be tuned into, like you said, the online resources and just know how to talk about it?
Yeah, that's a good question. So I would say that if they want to be a key account manager, that getting that education is going to be really
Necessary.
important because of me as the hiring person, the VP, I say who has demonstrated success, but also who demonstrates that knowledge of the insurance environment, right? And so if you want to get into that, then that's good. Now, there's so many routes that you can take, right? You can go through sales management. Um, and a lot of times I hired people who were managers of people before. And several of my companies in the past, you had to be at a manager level to actually move into the insurance or
Sure.
payers
Sure.
area, right? Because you demonstrated a whole lot of things, right? Leadership,
Sure.
strategic thinking, time management, so many different things.
Okay, so let me make it a little more pointed with the question. So if I want to be C-suite one day, right? I want to be a
Yeah,
COO or CCO or whatever,
right.
and I'm currently a rep, and I have the whole. I'm a young woman or man, and I have my whole life ahead of me. Do I need to anticipate getting into the insurance side of the companies I work for, or can I stay out of that and just make sure I'm versed and I'm checking out resources like CMS.org and doing everything you've recommended on this show today?
Yeah, I would say that, for example, my CEO it was head of insurance and payers at
Oh,
a
wow.
previous organization.
Okay.
However, there are other CEOs that I've had in the past or chief commercial officers who actually went the marketing route,
Sure.
which is another route. I think it's really important. I'd never got into marketing. I did a little bit in Amgen when I was there, but it's a good route. It's a route that is solid. You learn real skills, you learn budget management, and it's an important part of most organizations. And so that's another route that you can take. There's also a financial route, right? Where you're managing budgets, you're managing dollars,
Sure.
and rebates and things of that nature. So that's another way that you can go to be able to get there.
With the landscape that we've described today, 10 years from now, do you think you're going to be saying the same thing as far as the route you should be taking, or do you think it's going to be a whole different world?
I think with the advent of AI, we don't know what technology it is going to do to the entire market. And I'm not just talking pharmaceuticals or biologics or anything like that. I'm talking about everything.
Sure.
We don't know how that technology is going to play out from a business standpoint and a sales standpoint. And I just don't have enough information to be able to make that call.
So yeah, with AI, are you worried about it, Jasper? I mean, do you kind of look at it like it's going to be what it's going to be, or is this something you find yourself thinking about often?
I would say that I'm not worried about AI. I've been around long enough, and seen so much changes in technology that I think you can't stop technology, you can't stop progress. I utilize AI every day. When I get information about a situation that I need to take care of, I'll put all those things down into a list and then, pose the question to AI to say, or ChatGPT, hey, here's what I need to accomplish. I need to influence this person, and I need to have a response. Please spit me out what you think of this. So,
Got it.
yeah.
Got it. Okay. And I do have one question about those who want to break into medical sales. You're the insurance guy. We've talked about insurance for the last 30, 40 minutes. I want to break into medical sales. How should I be, I don't know, researching insurance to showcase it maybe in an interview, to showcase that I have chops around it? Or should I even be doing that? Is it beneficial to me, the guy on the outside or the girl on the outside that wants to
Hmm.
be in, and I'm
Right.
interviewing, and I'm talking to all these people about trying to get a position? Is there any benefit to me being able to speak proficiently about the insurance and how it's being done in this country?
I think you can make a connection between what your current role. I mean, if you're a student just graduating, you don't have really a current role, but you could talk about your insurance at school and your parents. But I just don't know if there's an opportunity for people to, to understand the insurance. I don't know if it's going to help them get their foot in the door.
Sure,
I think
sure,
that's what I'm trying to say. Because right now it's connections, your network of people that you have, it's your training. Do you have a relationship with healthcare or medical or something like that, or science, or do you have like a financial or marketing background?
sure, sure.
And then the questions are, are you the type of person, the right person that can function under a sales quota, right? Where you got to hit that every quarter.
Yeah,
And some people can't handle that
yeah,
stress or that pressure.
absolutely.
So you got to figure that out for yourself. I think understanding about insurance and how it works is never going to hurt you, but there's other things that you need to do to be able to get your foot in the door.
Fair enough.
Yeah.
When you started your career in medical sales, it seems like you've been in insurance from the jump.
No, no, I started as a sales rep.
You started as a sales rep.
Hmm.
Wow.
Started as a
How
sales
how
rep.
long ago? Date yourself, Jasper. Date
All right.
yourself right now.
I started as a sales rep with a company called Upjohn
Okay.
in 1980.
Wow. Wow. Okay.
And Upjohn had a product called ibuprofen,
Wow.
which was a prescription product for arthritic patients, patients with rheumatoid
Okay.
and osteoarthritis. So I introduced 600 milligram Motrin. I introduced 800 milligram Motrin.
Okay.
And we had other products. It was a very, very good company, but it was
Sure.
set in its ways, and they eventually had to sell over to another European company. And so I moved to another company, a smaller company called Key. That was a startup. We had sustained release nitroglycerin patches for patients with angina.
Sure.
So I had picked up 2 states. I travel all just
Wow.
driving,
Wow. Yeah.
made a
Yeah. Yeah.
lot of money,
Yeah.
and it was a lot. It was a lot of fun. They were sold to someone, and I went to do sales training out in New Jersey, and they were sold to Shearing Plow, and
Okay.
did sales training, and then they moved me to Chicago as a district manager.
So
So things
you
kind of
were
happened quickly. So
you were in medical sales during the heyday.
yeah.
I mean, you saw the craziness, the baseball games, the concerts, the all of it.
We did a lot and samples, so
And
I mean,
samples.
we used to, okay, samples were good because it
Sure.
helped patients to get on drug, but we
Sure. Sure.
also
Sure.
provide them to the pharmacist for taking care of, patients and things like that, or exchanging them for returns. And I think the level, I don't think they can come after me now for something that happened that long ago. So, but
Sure.
everybody was doing it at that
Hey,
point.
so when I entered the industry, all that had just the kibosh had been put on all of that, like right when I entered. But I
Yes.
still hear the stories. So then, how far into your career do you decide I want to go the insurance route, and what made you decide I want to go the insurance route?
I would say it was with a company that I became a key account manager, right? And that's with larger accounts. I did long-term care, I did prisons, things that are out of the ordinary, not just calling on doctors. And it's
Sure.
because, I was able to exhibit calling on doctors, first of all, that I was proficient at that, but I
Sure.
also had other abilities to be able to move into other areas. Somebody moved on or left the company, they need to find somebody to pull in. You either bring somebody from the outside who you don't know, by the way, or whether they're going to be effective or go to work or any of those things, versus the person that you know within the organization that
Sure.
is already working at a high level.
Sure. So, but still, okay. So I guess then the question is, why did you choose key accounts? Why did you want that?
More money, bigger
Okay.
salary, bigger
Really?
bonus,
Okay.
but I'll say this, more pressure on you. So
Okay.
you have to be able to handle that pressure, right? Because if you're handling larger accounts that have more contribution or a larger contribution toward the profitability of the organization you're working for,
Sure.
and people are going to pay attention to you and what you
Sure.
do every day.
Sure.
So there's more pressure on you to get things done. Um, you'll have a vice president or a senior vice president at a meeting walk up to you and say, "We need to get, Illinois, the state of Illinois, taken care of. Do you got this?" And you gotta shake your head, go, "Yep,
Show up and say, I
everything's
got
lined
this. I'm
up.
on it.
It's
Yep.
it's
Yep.
ready to
My
go."
man. Yep.
So
Yep. Okay.
so so you get access to people maybe that you wouldn't, as the higher you go up and the more sales profit responsibility you have, the more exposure you get to higher leadership.
Sure. And then last few questions. Right now, as director of all these of national accounts, what do you spend your day doing? I mean, what constitutes your, for lack of a better way of saying it, 9 to 5?
Yeah. I would say first thing is I check the sales report in the morning to look at where there's issues, where something that's taking a long time to get a script through. I try to be proactive as much as I
Sure.
possibly can. Secondarily is getting emails from people and saying, "I'm getting blocked at this account, or I'm getting blocked in Michigan, or I'm getting blocked in Missouri or Colorado. Can you help with this?" So
Sure.
now I've got to ask them the right questions. And I've gotten the reps to the point now where they're starting to get the information I need and go,
Nice.
"Jasper, okay, if I'm going to take this to Jasper, I better have all these down because he's going to ask me about
Nice.
this, right?
Yeah.
What's
Yeah.
is it commercial? Is it Medicare? Is it Medicaid? Who's the PBM? Is this give me the details and then I can go and try to make an effort to help you. So, one issue like that might take an hour,
Okay.
maybe an hour and a half to
Sure.
try to address it. And then you got to communicate back to the people, especially their leadership,
Sure.
as to what your progress is. And that occurs all the time. So our chief commercial officer, he asked us a bunch of questions in the month of March, and I listed them all out and put dates behind them. And every week I give him an update on how I'm making progress on those issues that
Sure.
he brought up. So I would say that just keeping people informed is the main thing, and taking action. When people throw an issue with me, it's not that they're saying that they expect you to do this like right away, but they just don't want you to go dark. You can't ghost anybody. You have to respond to them as quickly as possible, let them know that you're on it, and then make a note to yourself that you got to follow up within the next day or 2 days later, just so they know that you haven't forgot about the issue they're dealing with.
Makes sense. So you're pretty much doing that up until the end of the day.
I have a reputation as a doer. I have a reputation as a person that gets, what
Gets it
done.
done.
And and it's not so much that it all turns out good, Samuel.
Mhm,
It's
mhm.
that somebody is actually working on it and taking
Persistent effort. Yeah,
responsibility of it, right? Yeah.
I love it. I love it. So now in your second act, you earlier you said you retired, and then they called you back, and you said, I'm bored. I'm gonna go back. Uh, in your second act, what do you hope to see? What are you trying to do now?
I think in the second act, I like to use everything, good and bad, that I've learned through my career to help, first of all, the organization to succeed. But secondarily, I mentor two or three people in the organization. They want to move up, like you and I have been talking about today. And I help them. We talk about where they're at, what they want to do. What are the values that they bring to the table? How much research are they doing on insurance companies and all, and their territory and their doctors? How well are they communicating with people? So I help with mentoring. So I want to continue doing that. Um, and I don't think I'm ever going to quit. I love what I do. I have a reason for getting up in the morning, and
Yeah,
I
yeah.
feel energized, and I will be 70 years old in September.
Wow. Hey, you're doing everything right, Jasper. I did not know that. So big ups to you. Look at you. Wow, you're on the move too. I respect it. I want to be like you when I grow up. Well, this has been fantastic, Jasper. You're doing amazing things. How can people reach you if they want to seek out mentoring? If they love what they've heard?
LinkedIn, you can look me up on LinkedIn. I'll respond back as quickly as possible. And anything, that I can help people with if they're interested in getting a job and want to come up with a plan. I'd be more than helpful, more than
Man.
happy to assist people.
Last thing, we got one more thing to do before we wrap up today. Are you ready?
I am ready.
This is called the lightning round. I'm going to ask you four questions. You
Okay.
have less than 10 seconds to answer. So basically, the first thing comes to mind. And here we go. All right. What's the best book you've read in the last 6 months?
I would say I'm going to forget the name. It's it's a spy novel. Spy novel. Let's
Okay.
just call it a spy novel. Yeah.
Okay. So, I mean, can we get the name and the author at some point?
Yes. Yes.
Okay.
At
Okay.
some point, you.
Well, it will be in the show notes. The spy novel name
It's
and
sitting
author
on my bed upstairs. So.
will be in the show notes. Okay. Second
Okay.
question. What is the best TV show or movie you've seen in the last 6 months?
Best TV show, movie in the last 6 months.
Or movie?
Uh,
Either or.
yeah. I just um, I would say um, I've been doing a lot of stuff with my grandchild, and we
Nice.
went to see this thing about the amazing crayon. It was so
Very cool.
innovative. It was just so really cool. So
Very cool. How many grandchildren
yeah,
do you have?
I have two.
Nice.
Hendrix is
Nice.
14. Luna's 7, going to be 8 soon. So.
Very cute. Very cute. Okay. And then third question. What is the best meal you've had in the last 6 months? We want the restaurant, if you can, the item, and of course the location.
Oof. Man, you asked me a lot of details, man. I'd say we took my daughter and I and family went to in New York. She lives in New York. We went to this Italian joint, and I'm not going to remember its name, but I will say I would say I had my birthday at one of my favorite restaurants, and we love the people who own it. It's called Maison Pickle, and
Maison
it's in
pickle.
Yeah, it's in Manhattan and it's got the best food. And if you go there for brunch, they have a waffle and chicken that's the size of the
Oh
size
man,
of a
Maison.
mountain.
Okay,
It's really,
Maison
really
pickle.
good. They're
Very
great
cool.
people.
Maison
Yeah,
pickle.
yeah.
Okay, thank you for that. And then last but not least, what's the best experience you've had in the last 6 months?
Best experience the last 6 months. Um, I would say traveling to Asia. I had never been to Asia
Sure.
before. I mentioned that I traveled to Japan.
Yep.
Uh, Wonderful experience. People there are so kind and friendly.
Yeah.
They are very automated. They don't touch things. You
Yeah.
just,
Yeah.
you put your phone up and boom, boom, boom,
Yeah. Yeah.
you're just there. And then I went to Thailand from there, which was an amazing experience. I love the people there, and I think it was almost life-changing to
Amen to
visit
that.
both of those places. Yeah.
Amen to that. That's beautiful. So when you went to Japan, was it Tokyo or was it somewhere else?
No, I went to yeah, it was Tokyo. It
It was
was
Tokyo. Yeah.
Tokyo. Yeah, I went to
I've
Narita
been to
Airport.
Tokyo and I've been to Thailand, Phuket, um, and the main city. And I'll tell you this, in Japan, I almost wonder if they train people to be really nice to foreigners because I mean I've never been treated that well in my entire life, and I've been to so many countries, and Japan would it stood out like a sore thumb how kindly I was treated. I mean I felt like royalty in that country, so that's so cool that you had that experience. And Thailand, yeah, that can be a spiritual
So I
experience too.
went to Pattaya
Okay,
and Bangkok.
okay,
But once I got to Pattaya, I reduced down my days in Bangkok because it was just I love the beach. They
yeah,
had an
the
international
beach.
jazz festival on the beach, free of charge,
Wow,
50-cent
wow,
beers.
that's
It
beautiful.
was just it was amazing. And then
Yeah,
the
yeah,
the music and the how friendly people are and how people are from all over the world.
yeah, yeah.
Yeah.
That's amazing. Jasper, again, thank you for sharing the time with us. You just dropped so many pearls and so much wisdom today on this show. It's amazing what you're doing. We can't wait to see as you continue with SC Pharmaceuticals. And thank you again for being on the Medical Sales Podcast.
Hey, no worries, Samuel. Pleasure to meet you finally.
Absolutely. And that was Jasper Freeman. Man, fantastic stuff. What I love about this episode is he really does have a command over how insurance works in this country, but just as importantly, how it works globally. And it's kind of interesting to hear that as prominent as we are here in the United States, we are not the ones that are doing it the best and getting the best patient outcomes. And it's also fascinating to know that the monopoly that pharmacy benefit managers have, how the pendulum is starting to swing. The things that happen in this country, it's almost like a cycle. It goes one way and then it goes the other way, and it all happens over a course of 50 to 60 to 70 years. And it looks like that's happening in the pharmacy and insurance game today. Thank you for listening to the Medical Sales Podcast. If you're listening to this episode and you're thinking to yourself, I want to do what Jasper's doing. How do I get part of this world? Where do I go? Or maybe you're thinking, I want to make moves and advance in my career. And I love the things he was saying. Then I'm going to tell you to go. EvolveYourSuccess.com. Get access to us and let's have a conversation. And if you're listening to this podcast and you love the things you hear, then make sure you go to Spotify, you go to Apple iTunes, and you rate this podcast. Give it a true rating. If it's 5 stars for you, then let people know about it. And make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at EvolveYourSuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.